The purpose of this video is to talk about ear infections from a chiropractic perspective. Ear infections are affecting 85% of our kids in America today. And while ear infections are common, they are not normal. So just like little Miss Sweden, if she had an ear infection, I wouldn't consider it normal, but it may be common for kids today to have those kind of things. So typical course of care for people with ear infections is antibiotics to help with the bacteria that's being grown in the ear and remove it so the kids feel better. And if that does help, then kids get some relief. Typically, though, we get multiple rounds of antibiotics, and then the ear infections keep coming back. They reoccur. So the doctor has to give the kids tubes to help with the drainage. And what they're trying to help with drain is the eustachian tube. Now, on Sweden, the tube would be right behind the ear going down into the throat, and that's what allows the drainage from the ear to go down into the lymphatic system, which actually is in the back of the throat, to help these, the normal drainage that would be in a child. With ear infections, typically what happens is the tube gets kind of blocked and the drainage doesn't occur, and it backs up into the ear, and it creates like a stagnant area for the bacteria to grow, which creates the infection and creates discomfort for children. So the antibiotics' purpose in theory is to go in and kill the bacteria and help that problem to feel better. And if that doesn't work, then the tube's theory is to help promote the drainage in that area. The problem with this most of the time is that it never addresses the cause. What's causing the lack of drainage in the first place, and why did we need to drill a tube to make the drainage happen? So a couple things from the chiropractic's perspective. As we talked about in the first video, the brain controls everything, and just like the skull protects the brain, the spine protects the spinal cord and the nerves. And when that spine is in alignment, it allows for proper transmission of nerve impulses from the brain to the body. So the ear has to receive the message from the brain. And as long as the spine right here is in alignment, the message can get here. Okay? And if the message can't get there, then we have problems with the ear functioning, with it draining, and things of that nature. So the little eustachian tube has a very kind of fancy muscle called the tensor veli palatini muscle. So if this is your eustachian tube, there's actually a muscle that goes around it and contracts and relaxes to allow that eustachian tube to stay open. So if we have a subluxation of the spine and misalignment, it can interfere with the nerve flow to that muscle. It can actually cause the muscle to contract around the tube. Now trying to get any kind of fluid through this tube that's now contracted is a problem. Okay, so that's the cause of the typical ear infections, if we can't get the tube open, so they drill a hole. What a chiropractor would do is adjust the spine to remove the nerve interference and allow the muscle to relax so the tube can open. Now the fluid can drain through the hole. So typically we're looking at the upper two bones of the neck that control nerves to the ear. We want to make sure that we've removed any interference here so the eustachian tube can open back up and we can get drainage into the ear. The second thing that happens with tube and ear infections and antibiotics and all that kind of stuff that we try to steer away from with chiropractic is overall the whole neck has to move. So Sweden, can you tip your head all the way back for me? And down, all the way down. Good. And back up. And turn all the way that way. And all the way this way. Good. Now she has really good movement of your neck. You can come back to the middle. Now if the neck doesn't move like that because there's a subluxation present, then what can happen is it doesn't allow for the proper drainage below the second and third levels of the spine. So with proper movement of the neck, it kind of massages the fluid in the ears down all the way. And when there's a subluxation, it's what we call it's fixation. So I'm just going to show you something here. Over here we have this little container, and it has a hinge, and this thing opens up like this. Well, if I took this hammer and I smashed this hinge, and I bent the hinge, well, how well do you think this lid would open and close? It'd be rough, right? It wouldn't do what it's supposed to do. It wouldn't move like it's supposed to move. And the opening and closing of that lid wouldn't function like we want it to. So when we have a subluxation of the spine, the proper movement of the neck can't occur. It gets stuck, it gets interfered with. And so the proper motion of the fluid going down into the neck can't happen because we don't have proper movement of the neck. Now Sweden had very good movement of her neck, but if she was stuck and couldn't move, well, then the drainage that's supposed to happen and occur couldn't happen either. So a couple things happen. We kind of have a double whammy. Subluxations create fixations, or like hinges that don't function, creating a lack of movement and a lack of fluid moving down the neck. And subluxations also create nerve interference, which puts pressure on that muscle that goes around the eustachian tube, which can close down the tube. We don't get drainage that way. So instead of using medications or surgeries, we look to the cause of the problem, see if we can remove the interference, get better motion in the neck, better nerve flow to the ear, and remove the symptom naturally without any major intervention. So that's how we would take care of some ear infections. Now again, we don't treat ear infections, we treat the cause, which is a subluxation, and naturally the body kind of heals itself and takes care of the problem without any major interventions. At Winfield Chiropractic, we take care of families and kids, especially kids with ear infections. We don't like to see children suffer with things like this, and we know we can help. At least we can check to see if they have subluxations. So if you have any questions or concerns, or you would like us to check your child or a child that you know, give our office a call and we'll see if we can help out.